Hi everyone, my name is Amy and I am a speech and language therapist. So what we're going to talk about today is what the job of a speech and language therapist is. At the top, we have some websites if you're interested in learning more about our profession. So, what is a speech and language therapist? We are an allied health professional career. What this means is that we work in a caring role. A lot of speech and language therapists will work for the NHS. Others will work privately, and we work in a team with other health and educational professionals. This might include doctors, teachers, and other types of therapists. For example, in the picture, we've got an art therapist and a music therapist. We also might work with hearing specialists or sight specialists. So we work within a big team to support our patients, and we work with the wider family of these patients as well. We work with children and adults with communication and/or swallowing difficulties. So let's first talk about communication skills. This is a person's ability to understand verbal information. So when I'm speaking, can they process what I have said and respond? This also includes their use of language. When someone is speaking, are they able to get their message across effectively? We also look at things like speech sound difficulties. So are they pronouncing things the right way? For example, a child might say gog instead of dog. We also look at social communication. We can see children and adults with swallowing difficulties in hospitals and the community. We prevent people from getting something called aspiration pneumonia. This is a chest infection that can be quite serious. This can happen when they swallow and it goes down the wrong way. Once we have received a referral, the first step is to assess the patient's communication and/or swallowing needs. We might come up with a diagnosis. Then, based on all this information, we will then make a treatment plan. Speech and language therapists can work in different settings, for example, community clinics, mainstream schools, or special schools. Community clinics are a bit like a GP practice, which you visit and see your speech and language therapist there. Other settings include hospitals or going into people's homes. So, who do we help? Speech and language therapists are qualified to work with people across their whole lifespan, from babies to the elderly. We have a list here of different things that we support. With babies, it might be feeding difficulties. If they're not able to eat or drink, we can start helping straight away. Or if the child has a recognised learning disability, we can help support their communication. When children get older, we might start seeing them for things like autism or a language difficulty. Here it says developmental language disorder. That is a term for difficulties in understanding and using language. As well, we might look at children and adults who stammer, like the King in the King's Speech movie. There's also plenty of films and television series about autistic people, for example, The A Word. Moving into adulthood, we might look at people who have had head and neck cancer, so that could be helping them with their speaking or with their swallowing. We also work with people who have had a brain injury, a stroke, or who have motor neuron disease or dementia. Most of our work involves working together with a range of professionals, for example, educational psychologists, pediatricians, neurologists, and many more.
So what are the skills and qualities that are most important as a speech and language therapist? There's quite a few. One of the most important ones is enjoying working with people, because this is how we get all our information. We're working directly with people, we're chatting to the person that has difficulties, as well as family members, different members of the team. So that's a really important skill, and being able to communicate well with them. So giving them information in a way that other people understand. And as well, being caring. So, caring about what the patients are going through, and being empathetic as well. So just, showing them that you understand what they're going through, and that's the best way to kind of start supporting them with that way, because we need to get them on board as well. Also with that would go with good listening skills as well. So being able to listen to patients and hear their stories about their difficulties. And as well, we've got organisation skills as well. So this is one that I needed to practice. We're not expecting everyone to come in and being completely amazing at all of these things. Like, it takes practice sometimes. So for me, organisation is an area that I found difficult at the beginning. There's a lot of organisation that you have to do as a speech therapist. We see quite a few people in one day, and it's not just seeing people. We have to write up the notes, we have to write reports, we have to, after we meet someone, we might have to meet someone else as well to chat about, you know, to relay the information. Yeah, so there's a lot of organisation, and as well, problem solving is a really important skill. So if you have a patient and they can't express themselves using language, we have to think about different ways we can go to get their voice heard. So, you know, to get their opinions across. So there's lots of different methods that we have to, you know, try to help them get that message across. And as well, you have to enjoy working in a team. As I keep saying, it's a big team, and the communication skills have to be really good between you. So enjoying that is really important to you, and, you know, enjoying the role. So what do I enjoy the most about my job, and what is most challenging? So there's a lot of things that I enjoy about my job, which is good. And there's definitely some challenges that come along with it as well. So in terms of things that I enjoy the most, I would say one of the key ones is getting to see children and teenagers develop their communication skills. So getting to see that progress that they're making. If someone's making progress in those skills, it really impacts on their whole life. So if they're developing their communication skills, they will also then, an impact might be that they're developing their friendship. So they're getting more friends, or they're able to keep friends for longer. They're able to express their opinions more, maybe in the classroom, or, you know, they'll improve their learning because they're understanding more of maybe what the teacher's saying when they're giving instructions. Because if you can't understand the instructions that you're given at the beginning of a lesson, how are you going to be able to complete the work in the same amount of time as someone who does understand it? Another thing that I really enjoy is my job's quite active. I'm on my feet quite a lot, and that's especially with the younger children. So when you're teaching communication skills, a really nice way of doing this is through playing with them. So sometimes, the other day, I was out playing football with a few of the children, and that was to develop their social skills, so being able to take turns. And it's just really nice to get out there and be active. And then in terms of challenges, I would say my main one is report writing. I said I'm active. I'm not very good at sitting down for long periods of time. Most of the reports are only about an hour, but some of the big ones, and they don't come along very often, but some of the big ones can be about 3 hours. So they're the ones that I kind of find a bit more challenging, because I like to get up. I kind of need breaks when I'm doing that. So I might go get a coffee, things like that, just to kind of break it up a bit. So there's ways of combating it, but that's probably my biggest challenge.
So how can you become a speech and language therapist? Well, you have to go to university to train as an SLT. You can go straight from sixth form, straight into university, or some people like to take a gap year to work or travel and then start their university journey. You can also train as a speech therapist after you've already done a very different degree. Sometimes people come to the profession from lots of different experiences and backgrounds, and they're really varied. They can include things like psychology, biology, biomedical sciences, modern languages, English, linguistics, drama, law. It's really not uncommon for people to retrain as a speech therapist after gaining experience in a completely different career too. You might be a teacher, a librarian, a lawyer, as I said before, many different careers, And then there may be that one experience or story or something that piques your interest that gives you that passion and drive to retrain as an SLT. Now, because of this, there aren't any specific GCSEs that you need to take to pursue speech and language therapy as a career. But of course, your core subjects like science and English are going to be really important because biology and neuroscience form a big part of your university degree, as does English and linguistics. What I would recommend if you're taking your GCSEs or choosing them is to choose what you really love, what you're passionate about and what you enjoy. At A level, having a science subject can be really helpful, but it isn't always completely necessary. So for me, for my A levels, I did biology, sociology, and media studies, which is quite a variety of subjects. They're quite far-ranging. And this was good for me because I had that foundation in science, but I also had lots of opportunities to develop teamwork, communication, and problem-solving skills through media studies and sociology. It really widened my eyes to a big world view of things. So you may want to do something similar. If speech and language therapy is something that you're considering but not quite sure about, or if you want your university application to be really convincing that you're sure that this is the right career for you, then I would really recommend that you get some experience in working with people, volunteering, and that can be with people from a range of different backgrounds and ages. It could be that you volunteer at your local primary school for an hour a week, or perhaps help in coaching team sports, or volunteering to support people living in care homes. There are lots of volunteering opportunities out there. You can also just search online. There are organisations like the Stroke Association, for example, that may have volunteering opportunities. So have a look at what's available and start getting some experience in what it's like to be involved in a caring profession where you get to practice your communication skills all the time. Not only will this really help you to be sure that it's a career you want to pursue, but it will look brilliant on your university application form, as I said before, because it will show that you've already made an effort to get some idea of what it's like to work in a caring profession. So definitely give that a go. And finally, what does the future of the profession look like? Well, historically, diversity has been an issue in our profession. It does tend to attract a lot of white middle-class women. But since we work with people from a very wide range of backgrounds in the community, we think it's really important to try to make sure that our profession reflects the community we work with. So in our team in Ealing, for example, we recently formed a diversity and inclusion focus team to try and ensure that we foster an anti-racist culture within the team. And on a wider scale, the Royal College of Speech and Language Therapists are currently doing lots of work to support developing a support network for therapists from ethnic minorities, developing a support network for people with disabilities, and supporting people from disadvantaged backgrounds to overcome any barriers to joining the profession. And of course, as we are doing today, they are also promoting speech and language therapy as a career. So how about COVID? Of course, that's played a really significant part in all of our lives over the last couple of years. What impact has that had and what does the future look like? Well, we've had to get used to doing lots more remote working online. We've actually developed a brilliant teletherapy service so we can continue serving the community, but in new ways. So as a profession, it's the kind of job that's always evolving, always adapting and changing, which is great. No 2 days are ever the same. So that brings us to the end of today's presentation. I hope you found it useful, and we really wish you all the best in your journey into choosing the right career for you.